Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a different kind of PCOS topic. It is a very rare kind of PCOS, which is nothing but adrenal PCOS. In the previous videos we have discussed about PCOS, we have discussed about signs and symptoms of PCOS, we have discussed how insulin resistance and PCOS are related, how stress is related to PCOS, and we've already discussed how obesity and PCOS are interrelated. Today, the reason why we have selected this kind of topic is that people do not know that they are suffering from this kind of PCOS because it is hard to diagnose, and also not only that, the cases of this kind of PCOS are slowly starting to rise up. So let us know more about adrenal PCOS by taking an explanation on the screen so that you will be understanding it in a better manner. Let's dive into the topic. What is this adrenal PCOS? You have to remember first what is adrenal gland. So adrenal means adrenal gland, which is located on the top of kidneys. Like for example, if this is right and left kidney, we will be having adrenal glands on top of the kidneys, right? And adrenal glands release certain hormones in stress conditions. Okay, so these hormones are something that are causing this PCOS symptoms. So what are the hormones that are causing PCOS symptoms? Adrenal PCOS is a subtype of PCOS. It's a health condition where the adrenal glands are responsible for the overproduction of androgens. This is very, very important. See, adrenal PCOS means that there is overproduction of androgens by the adrenal gland, which causes PCOS-like symptoms. Why does it cause PCOS-like symptoms? Because PCOS also has hyperandrogenism. PCOS is a triad where any of the two in a triad, if you are if you are having any of the two in the triad, that means you have PCOS. What does the triad constitute of? The triad constitute of first pi category, which is P for polycystic ovaries, I for irregular menses, and E for excess androgen or hyperandrogenism. So even in adrenal PCOS, we have hyperandrogenism without any involvement of female reproductive system. So that is why, because of this hyperandrogenism, there are PCOS-like symptoms developing. So now let us know what are the hormones that this adrenal gland releases and how do they affect the body. As you can see here, adrenal PCOS is a rare condition, but the cases are growing day to day. Why do the cases grow day to day? Because of the lifestyle disorder. What is the lifestyle disorder that is triggering this adrenal gland? That is nothing but stress. So whenever you are under stress, what do you mean by stress? Stress, if you are hearing about something or a stressful event, if you are seeing a stressful event, if you are experiencing some lifestyle changes, or if you are having chronic sleep loss, or if you are having insomnia, if you are having a lot of desk job and you're not moving, if you're just eating fat food and you're emotionally wrecked, then that means stress. Okay, whenever you are stressed, what happens? The body or the brain itself is activated, and there is a region in the brain called the hypothalamus wherein it releases CRH. So whenever you are experiencing stress, the body or the brain itself is activated where the hypothalamus releases CRH. Okay, and then the CRH triggers the pituitary to release ACTH, and this adrenocorticotropic hormone, what it does is, this is the adrenal gland which is situated on the top of the kidney. This adrenal gland will be releasing two types of hormones. One is called as DHEA and the other one is called as cortisol hormone. So as you know, cortisol hormone is released under stress. It can be acute or chronic stress. If it is acute stress, it is helpful for the body in evaluating, it helps in cognitive function. But if it is chronic manner and your cortisol is being released in a chronic fashion, then it does cause immunity problems and it causes other problems as well. We have discussed all of that under fibroids and stress topic. So if you want to check out about stress and how it affects the body, we've already discussed it. The link will be provided in the description box. You can go and check that out. Right? So today we are not talking about cortisol, we are talking about DHEA. So under stress, the hypothalamus is triggered, hypothalamus triggers pituitary, pituitary triggers adrenal gland produces two hormones, which is the DHEA and the cortisol hormone. So what does this DHEA do and why is it harmful for the body? So remember, DHEA on a lower rate is not harmful for the body. DHEA is a precursor of androgen or precursor of testosterone. Okay, it directly does not release testosterone, it releases DHEA sulfide or it releases DHEA sulfate, okay, or DHEA -S, that is what we call it. Okay, So this DHEA is converted into androgen under bodily conditions. Whenever body needs a certain thing, it is converted. Okay, but what happens in this adrenal PCOS is that there is a lot of DHEA releasing, and this DHEA is converted into DHEA sulfate is released, that is converted into DHEA into androstenedione, and that is into testosterone. Okay, so this testosterone accounts for the hyperandrogenism characteristics. So what are hyperandrogenism characteristics? We will be discussing as we go through this topic. You have to remember that adrenal gland is releasing a precursor for testosterone, and the testosterone is being increased. So what happens in PCOS is that the contrary factor, here adrenaline has no issue with the ovaries of the body, right? But here what happens in normal PCOS is that due to brain releasing a lot of GnRH hormone, the GnRH increases the luteinizing hormone. The luteinizing hormone triggers the ovarian thecal cells, and they produce DHEA directly, and they account for 20% of DHEA, 50% of anistenedione, and 25% of testosterone. Okay, and this is again converted into testosterone. The precursors are converted into testosterone. So here ovaries are being affected because of high luteinizing hormone. Here adrenaline gland is being triggered because of stress. What are the symptoms of adrenal PCOS? We will be discussing adrenal PCOS along with the normal PCOS symptoms, so that you can catch up on how different both of them are. Just for a glimpse, I can tell you that adrenal PCOS and normal PCOS are not so different from each other. The symptomatology of adrenal PCOS and normal PCOS is not that different. There are very minor changes in both of them. So let us know deeply about that. So in adrenal PCOS, you will be experiencing a lot of prolonged periods, whereas in PCOS the periods can be prolonged, but in very lesser amount of people you will be seeing prolonged periods. You will be seeing scanty, and also you will be seeing delayed and irregular periods, whereas in adrenal PCOS you will be seeing irregular and prolonged period. Okay, and even sometimes prolonged cycle, which means late period also. And then in normal PCOS we'll be experiencing mood swing, which is not so common in adrenal PCOS. Here in normal PCOS you can experience insulin resistance really faster, and also obesity really faster, whereas in adrenal PCOS it runs as a chronic form and it takes years for that to develop. In normal PCOS you do not see a lot of sleep apnea, whereas in adrenal PCOS we do see sleep apnea as a common feature. And in PCOS you do have dysmenorrhea, which is painful menstruation, but compared to the pain scale of adrenal PCOS and normal PCOS, the adrenal PCOS pain scale is really high, and the amount of pain that the person experiences is too much, it's overwhelming. Okay, and also the bleeding is sometimes too much without any causation in the uterus or in the ovaries or anywhere in the female reproductive organ as such, right? And if you see a PCOS patient, you should be having any of the three in the pie category, which is polycystic ovaries, it can be irregular menses, or it can be hyperandrogenism. But if you see adrenal PCOS, you may or may not find polycystic ovaries. You can find polycystic ovaries in people who are suffering from chronic stress for a longer period of time, but whenever it is in the starting stage, usually most of the people do not represent with polycystic ovaries. They only represent with irregular periods and hyperandrogenism. Because they satisfy two of the pie category, they are called as a subset of PCOS. You understand it, right? And then what is the most common feature of adrenal PCOS that is not that likely in PCOS is the fatigue. Even though you're doing some sort of work, or even though you're just lifting your pen and keeping it somewhere else in some other room also, you just feel so overwhelmingly weak without any sustained cause. The reason behind it is because of a lot of cortisol hormone being released. Okay, so these are the symptoms of the adrenal PCOS when we are comparing it to normal PCOS. Now coming to how adrenal PCOS affects menstruation and what is the tests that have to be done for adrenal PCOS to be diagnosed. Remember that although in normal PCOS we do have fertility issues, the adrenal PCOS, the fertility issue mainly arises because of we have anovulator cycles in PCOS, right? So that is the main category or that is the main reason why many people do not get pregnant during their PCOS problem. But in adrenal PCOS, the problem behind the infertility or the problem behind not being conceived is that the periods are not regulated, so they're very irregular in nature. Sometimes it's prolonged bleeding, sometimes the bleeding is not there at all, and sometimes the cycle is so far from that, is so delayed and so late that you do not know when the ovum is being released and when you have to, get together to have this fertilization take place, right? So the problem here is the irregular and the prolonged or the delayed period sometimes. The period issues and the timings are the problem here. But if you are someone who can get tests done every now and then and you can monitor yourself, then fertility might not be a problematic issue in adrenal PCOS if your stress is under control, because this is some kind of a disease which comes under control with medication and with taking away the trigger, which is chronic stress, right? So how do you differentiate in based on tests the PCOS and adrenal PCOS? For example, if you're someone who's experiencing irregular periods, you have to first get your USG abdomen and pelvis done. And if there is no problem in USG and abdomen, the next one is hormone profile. If there is no problem even in the hormone profile, then you have to go for a test called as DHEA. DHEA slash or hyphen S sulfate test. DHEA sulfate test is a serum marker. You have to get this test done, and the level is too much. That means it depicts adrenal PCOS, and the trigger, which is chronic stress, has to be removed, and this condition will be reversed back, right? So these are some of the tests and how it affects the menstruation and fertility as well. So if you're someone who's suffering from adrenal PCOS and if you're going to a doctor and if it is a chronic condition, they might prescribe you oral contraceptives, anti-androgens to combat the androgens or the hyperandrogenism. And then if you are going into insulin resistance, which is although rare, but it can occur in people who are suffering from chronic time or prolonged time, as you can say. They will be giving metformin for your type 2 diabetes, and then they will be giving glucocorticoids and then hormone replacement therapies, and if that is not possible, they can do a surgery on the adrenal gland. So these seem fine, right? So what is the problem? The problem is the side effects. So if you're someone who's planning for pregnancy, contraceptives are not of much use. If you're stopping anti-androgens, then the androgenism will again revert back. If you're using metformin, you will start losing your muscle. If you're using glucocorticoids and hormonal replacement therapies, as soon as you stop, even the steroids, these are glucocorticosteroids are nothing but steroids itself, right? So they overwhelm the body. The hormonal fluctuation is too much after you stop. You can experience, mid-menstrual bleeding, and sometimes because of these hormonal therapies, you can experience a lot of blood loss also if the hormonal replacement therapy or the hormonal contraceptive therapy are not given by a proper doctor. You can experience overwhelming symptoms. You can experience weight gain. You can experience oily skin, acne, hair loss, and also you can experience hirsutism if it is not under control, if the androgenism is not under control, right? But you need medication or a type of system where it doesn't give side effects, it cures you, and it is effective in nature, and that is nothing but homeopathic form of treatment. It is effective, it's safe, it takes care of your menstrual cycle, it takes care of your heavy bleeding, it takes care of your hormonal imbalances, it understands your chronic emotional stress, and also it relates to the physical symptoms, because the doctor takes your mental picture and the physical picture and he connects that, and then the medicine will be given to you so that it acts holistically, and then it will help you in combating it. And remember, because there is also cortisol involved here, there is also immune problem, and you have to again use immune therapies or immune suppressants in allopathic form of treatment. In homeopathy, the medication, that constitutional medication, works in every possible manner to reduce the symptoms, to cure your disease, and to prevent future recurrences. So better opt for homeopathy because it's completely safe and it's very trustworthy and effective. No matter if you're using homeopathy or allopathy, if you're not able to handle chronic stress, then that will be a problem. So try eating good food, do not stress eat, and do not go on a fast without doctor consultation, that is intermittent fasting, and try to lose body weight, try muscle building exercises, and not only that, try to do meditation so as to calm yourself. This is very important. These precautionary measures are important so that the further recurrences can be prevented along with the medicinal help. If you're someone who's suffering from PCOS or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Here we have two kinds of consultation options. One is online and the one is offline or in-person consultation. If you're someone who's staying away from us or far away from us, you can contact us online, either through audio consultation option or through the video consultation option. And if you're someone who's staying nearby the nearest branch of Fidicus, you can contact us in person after the doctor consultation and the investigations after being verified, and then after taking case, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days, USA 3 to 5 business days. Across the globe, anywhere, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us, or message us. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here we have discussed why homeopathy is the best choice for PCOS or any lifestyle disorders as such. Here we will be discussing how Fidicus Homeopathy is the best choice of your cleaning. See, Fidicus Homeopathy stands on principles. It stands on highest chance of health. Here we are experiencing high success rate in people who have already suffered with PCOS, PCOD, endometriosis, adenomyosis, bulky uterus, fibroids, dysmenorrhea, and other female reproductive organ diseases. And second thing is that the treatment that we give here is transparent. That is, there is no gray area between the patient and the doctor. The prognosis will be clearly explained to you. And the third thing is the personal care. Here at Fidicus Homeopathy is top notch because we will be answering all of your queries and your questions, and we'll be busting all your myths. We will be educating you on your condition, on what to eat, what to not eat, what to do with the condition. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.